Hi, I'm Dr. Gerald Boey, physician from Vancouver, British Columbia in Canada. I'm the founder and director of Arbutus Laser Centre in Vancouver. I've been actively involved in various trials with lasers and other related devices over the past several years. I'm a member of the American Society of Laser Medicine and Surgery and the College of Physicians and Surgeons of British Columbia. Today I'll be presenting the science of cryomodulation, as well as sharing some of my clinical experience using this technology developed by R2 Technologies. I'll now go over some of my clinical experience and others, the clinical experience of others using the dermal cooling system. To date, there have been over 600 patient treatments across numerous studies in multiple centers. There have been numerous publications and presentations, some of which are shown on this slide. And there's extensive human histological evidence confirming the safety and effectiveness of this device. The clinical work that I'm now going to discuss was presented as a poster, actually, at the last ASLMS as an e-poster highlighting the new round applicator. Study design showed it was a prospective, non-randomized, multi-center study, 29 subjects receiving 1 or 2 treatments, and the clinical investigator and subject overall GAIS, which is Global Aesthetic Improvement Score. Photos were taken and the new round applicator was used. The objective of this study was to evaluate effectiveness of dermal cooling using the novel round applicator for discrete benign pigmented lesions. The treatment protocol is quite simple compared to the previous device, and I'll get into that a little later, the type of improvements that have been made. But the handpiece was applied simply using a hydrated interface gel to the treatment area. The selected profile was inserted into the system screen. The treatment is administered with the round applicator, and each handpiece placement delivered a cold cycle of less than 20 seconds. This demonstrates the results of the study. At 1 month, clinical investigators rated 58% of treated areas, and subjects rated 53% of treated areas having a GAIS score of improved to very improved. At 2 months post-treatment, the scores were slightly higher at 71% and 55% respectively. This is maybe one of the most important indicators. When asked if the patient would have the treatment again, 87% said they would, and 87% also would recommend the treatment to a friend. Since the e-poster, there has been continued patient treatments at Arbutus Laser Centre, but unfortunately much of this had to come to a halt with the advent of the COVID-19. And we're seeing very good results to date. I'll now show you some of the actual clinical results. Here is a dramatic improvement with 1 treatment, and the left is baseline, the right is 3-month follow-up after the treatment. In a Caucasian Fitzpatrick skin type 3, right arm, and lentigo, and as I mentioned, it's a single treatment. The next slide is a Caucasian Fitzpatrick type 2, and this treatment was on the right leg, both the seborrheic keratosis and lentiginous. There was a dramatic improvement after 1 treatment, 3-month follow-up, with the dermal cooling system. For those of you that use lasers and cryo perhaps for this type of indication on a leg, as you know, there can be significant downtime using lasers and cryo on the legs, and in this case there is virtually no downtime. The next treatment is on the flank of Caucasian Fitzpatrick type 3, and the SKs were treated twice. The one on the left is before, the one on the right is 2-month follow-up after the second treatment, showing almost complete resolution of the pigment and reduction in the size of the seborrheic keratosis. That would be the one up on the top left. Note that even if the seborrheic keratosis wasn't completely removed, most or all of the pigment was still removed. The next slide is showing effectiveness on the hand or the finger of Caucasian Fitzpatrick skin type 2, and this is 1-month follow-up after a single treatment. This patient is Asian, Fitzpatrick skin type 5, seborrheic keratosis on the left temple, and this is 2 months after 2 treatments, showing significant improvement without downtime. This is an interesting slide showing an SK on the right temple of a Caucasian Fitzpatrick skin type 2, and this is after 2 treatments. You can see the 3-month follow-up after the second treatment showing almost complete resolution, and you can see the actual little circles in the margin, and that's the circle from the actual applicator. This was done on purpose because the lesion was larger, and we wanted to just show the contrast of how the improved area looks. So, takeaway notes from this procedure. Most patients are seeing a significant improvement and are happy with the outcome, the vast majority. Generally, 1 or 2 treatments are required. Side effects are minimal. There is minimal to no discomfort and essentially no social downtime. This is a quick and easy treatment.